So my good friend and colleague, Dr. Kelly Casperson, was also one of the members of the panel, and I loved hearing what she had to say. She was asking about getting FDA approval for testosterone in women. And I think as urologists, we should be very interested in this topic because we are the champions of testosterone. We have guidelines on testosterone use. Unfortunately, at the current time, they primarily apply to cisgender men. And I think we can do a lot better than that. I think we can be the champion of testosterone use for everyone. Um, Testosterone is the most abundant sex steroid in all humans. The average reproductive age woman has more testosterone in her body than estrogen. We know that testosterone is critical for women's libido, clitoral sensitivity, lubrication, orgasm. There is a Cochrane meta-analysis demonstrating that testosterone supplementation in women in menopause improves all domains of sexual activity. So this is not, crazy out there medicine. This is evidence-based medicine, and it's based on physiology. And the thing I want listeners to understand is when there is a molecule in the human body, a hormone, and it is considered an essential hormone, then getting FDA-approved products related to supplementing that hormone generally just requires pharmacokinetic approval, meaning if I want a new FDA-approved testosterone product for men, what I have to demonstrate is that it's safe and that it raises testosterone levels. That's it. I don't need to demonstrate that it makes men hornier, or I don't need to demonstrate that it makes men have sex more often, or that it makes them score better on a cognitive test, because I understand fundamentally that testosterone is an important molecule in men's bodies, and men might have low testosterone, and if they need more, the product just has to raise testosterone levels and be safe, right? For women, it's a complete double standard. Testosterone products to be approved by the FDA have consistently required many hoops to go through. And we kind of have this dog and pony show, and we circle around looking for these vast clinical outcomes. And it does have good clinical outcomes, but we also really just require so much more than what we require out of getting products approved for men, which is primarily to raise blood testosterone levels to what we would consider, a young reproductive age person's testosterone levels. And I truly, truly hope that this issue is revisited as well. And I also hope that urologists take a front seat in championing testosterone replacement for women, as a professional organization in our guidelines and in our education.